Can you give bones to dogs? You've already seen that classic scene, a happy dog gnawing on a giant bone in the backyard. It seems natural, doesn't it? After all, for centuries, bones and dogs have been an inseparable pair, but is this really safe for our four-legged companions? The truth may surprise you. Thousands of dogs are taken to veterinary emergencies every year due to bone-related complications. Choking, internal perforations, broken teeth, and infections are just some of the risks that many pet owners are completely unaware of. Today, we're going to reveal the hidden dangers behind this deeply rooted tradition. We'll explore the different types of bones, understand why some are more dangerous than others, and discover what really happens inside your dog's body when it chews that bone you thought was harmless. We'll also share safe alternatives that satisfy the natural chewing instinct without putting your pet's life at risk. Get ready to discover information that could save your best friend's life. Before we begin, please leave your name and the city you're watching our content from in the comments. The tradition of giving bones. Let's start by exploring where this idea of giving bones to dogs comes from. This tradition dates back thousands of years, when dogs lived in the wild and needed to hunt to survive. Bones were a natural part of their diet, providing not only nutrition but also a way to keep teeth clean and jaws strong. With domestication, this image of the dog with its bone became a powerful cultural symbol. Cartoons, movies, and books always portrayed happy dogs with their bones. This representation created a deep mental association. Bone equals happy dog. The chewing instinct is indeed natural in dogs. They are born with the need to gnaw, especially during the teething period. Chewing helps relieve stress, maintains dental health, and provides mental entertainment. So when we see our dog chewing something, our first reaction is to think we're meeting a primitive and healthy instinct. But here's the problem. There's a big difference between what happened in nature and what's safe in modern domestic life. In nature, dogs consumed fresh bones from freshly killed prey, and those who suffered accidents simply didn't survive. Today, our dogs live much longer, and we have the responsibility to protect them from unnecessary risks. The reality is that many ancient traditions don't align with modern veterinary care. What our grandparents did with their dogs isn't always the safest thing nowadays. Types of bones. Not all are equal. Not all bones represent the same level of risk for your dog. Let's explore the main differences you need to know to better understand the dangers involved. The first important distinction is between raw bones and cooked bones. Cooked bones are extremely dangerous because the cooking process completely alters their structure. When heated, bones become brittle and tend to fragment into sharp, pointed pieces. These fragments can puncture your dog's throat, esophagus, stomach, or intestines, causing serious injuries that frequently require emergency surgery. Raw bones, while less prone to fragmentation, are not necessarily safe. They can contain dangerous bacteria like Salmonella and E. coli, which cause serious infections in both dogs and humans who handle these bones. Bone size also makes a crucial difference. Small bones can be swallowed whole, causing intestinal obstruction or choking. On the other hand, very hard bones, even large ones, can fracture your dog's teeth, especially the back molars. Chicken, turkey, and other poultry bones are considered the most dangerous due to their tendency to fragment into sharp splinters. Rib bones are also problematic because they can break easily. Even bones that seem safe, like large beef femur bones, can cause dental fractures due to their extreme hardness. It's important to understand that there is no completely safe type of bone for all dogs. Main risks for dogs. Now let's explore the specific dangers that bones can pose to your canine companion. These risks are more common than many pet owners imagine and can have serious consequences. Choking is one of the most immediate emergencies. When a piece of bone gets stuck in the dog's throat, it can completely block the airways. The animal may show signs of desperation, trying to remove the object with its paws, excessive drooling, and difficulty breathing. Without quick veterinary intervention, the result can be fatal. Intestinal obstruction is another serious risk. Bone fragments can accumulate in the digestive system, blocking the normal passage of food. Symptoms include persistent vomiting, loss of appetite, lethargy, and absence of defecation. This condition frequently requires emergency surgery to remove the fragments. Internal perforations are perhaps the most serious risk. Sharp bone pieces can tear the esophagus, puncture the stomach, or damage intestinal walls. This can cause serious internal infections, bleeding, and even death if not treated immediately. Dental fractures are surprisingly common. Very hard bones can break or crack the dog's teeth, especially the back molars used for grinding. These fractures are painful and frequently require tooth extraction or root canal treatment. Finally, bacterial infections are a constant risk with raw bones. Bacteria like Salmonella can cause severe gastroenteritis with symptoms like bloody diarrhea, vomiting, and high fever. But my dog has always eaten them and nothing has ever happened. This is probably the phrase that veterinarians hear most when they warn about bone risks. It's understandable that pet owners think this way, especially when they've seen generations of family dogs consuming bones without apparent problems. But let's explain why this logic can be dangerous. Bone risk is unpredictable by nature. A dog can chew hundreds of bones without problems and, on the next bone, suffer a serious complication. It's like driving without a seatbelt. You can do it for years without accidents, but when the unexpected happens, the consequences can be devastating. Veterinarians regularly treat emergency cases related to bones. Dogs that have always eaten bones without problems arrive at clinics with intestinal obstruction, perforations, or choking. Pet owners always express surprise, but he's always eaten this without problems. The issue is that risks don't disappear with previous experience. There's also what we call survival bias. That is, you only hear stories of dogs that ate bones and were fine, not those that had serious complications or died. This creates a false impression that the risk is lower than it really is. Additionally, some problems can develop gradually. Microfractures in teeth may not be immediately visible, but cause chronic pain. Repeated intestinal irritations can lead to long-term digestive problems. The age factor also influences. Older dogs may have less ability to digest bone fragments or have more fragile teeth, increasing the risk of complications even with bones they've consumed throughout their lives. Safe alternatives for chewing. Fortunately, there are many safe alternatives that satisfy your dog's natural chewing instinct without the risks associated with bones. Let's explore the best options available in the market. Natural chewable treats are an excellent option. Dehydrated pig ears, beef hooves, and tendons are popular alternatives. These products undergo processes that make them safer than raw bones while maintaining chewing satisfaction. However, always supervise your dog and remove small pieces that could be swallowed. Specific chew toys for dogs offer durability and safety. Recognized brands develop products tested to withstand intense chewing without fragmenting dangerously. Some are made with materials that clean teeth during chewing, offering dental benefits similar to bones. Edible artificial bones represent an interesting category. These products are made with safe and digestible ingredients, molded in bone shape. They satisfy the psychological aspect of chewing without the risks of real bones. Choose reliable brands appropriate for your dog's size. Interactive toys that dispense treats are also great options. They combine the pleasure of chewing with mental stimulation, keeping your dog entertained for long periods. For dogs with specific chewing needs, there are specialized veterinary products. Your veterinarian can recommend options suitable for your pet's size, age, and chewing behavior. Always remember to choose products appropriate for your dog's size and replace worn items that may pose risks. The role of the responsible pet owner. As a responsible pet owner, you play a fundamental role in your canine companion's safety. Let's explore how to identify risky situations and when to seek professional help. First, learn to recognize danger signs. If your dog is choking, you'll see desperate efforts to remove something from the mouth, excessive drooling, paws at the mouth, and possible bluish coloration of the gums. This is an emergency that requires immediate action. Symptoms of intestinal obstruction include repeated vomiting, especially if it persists for more than 24 hours, complete loss of appetite, extreme lethargy, and absence of defecation for more than 2 days. Don't wait to see if it improves on its own. If your dog seems to have pain when chewing, avoids eating on the usual side of the mouth, or you notice oral bleeding, there may be dental fractures. These situations require veterinary evaluation even if they don't seem like immediate emergencies. Constant supervision is essential when you offer any chewable item. Never leave your dog alone with something that could pose a risk. Remove small pieces that could be swallowed, and replace worn items. Understand that family traditions don't always equal safe practices. The fact that previous generations did something doesn't mean it's the best option today. Veterinary medicine has evolved significantly, and we now have knowledge about risks that previously went unnoticed. Talk regularly with your veterinarian about the best chewing options for your specific dog. Factors like age, size, dental health, and chewing behavior influence the safest choice. We've reached the end of our exploration about giving bones to dogs, and it's time to directly answer the question that brought us here. Can you give bones to dogs? The answer isn't simply you can or you can't. The real question is it worth the risk? After knowing all the potential dangers, from choking and perforations to dental fractures and infections, you need to ask yourself if it's really worth risking your best friend's health and even life for a cultural tradition. The risks are real and unpredictable. Veterinarians regularly treat bone-related emergencies, and they often involve dogs that always ate without problems. The luck factor is not a responsible care strategy. Fortunately, today we have safe alternatives that completely satisfy dogs' chewing instincts. Products developed specifically for pets offer the same benefits as bones without the associated risks. Truly loving your dog means making choices based on what's safest for them, not on what seems more natural or traditional. Sometimes the safest option may seem less authentic, but your companion's health is worth much more than any tradition. Reflect on this. Do you prefer to maintain a tradition or ensure that your dog has a long and healthy life by your side? The choice is yours. But now you have all the necessary information to make a conscious and responsible decision.